So why are prefabricated orthotics a great option in clinical practice? For many patients, you are able to get the same clinical results as you do with a custom orthotic, as they are either made to a prescription or chosen to match the prescription required based on the same clinical pathway. You can offer a faster turnaround time, including instant dispense. They are a much less expensive option for your patients, therefore leading to more access for more patients. And they're the perfect option for pediatric patients who will show significant foot growth over a short period of time. Prefabricated orthotics come in a range of styles, materials, sizes, and designs. The use of a prefabricated orthotic by a qualified health professional will represent a prescription orthotic for that patient and follows the same clinical pathway as a custom orthotic. After a thorough clinical history, physical exam, biomechanical assessment, diagnosis, and treatment-directed testing, identical to the clinical pathway for a custom device, this will lead to the selection of an appropriate OTC prefab with the desired prescription variables, or the creation of orthotic prescription, which will then be manufactured using a thermoplastic blank. In both cases, the orthotic is prescription for that patient, just like a pair of glasses.
So why do so many companies supply prefabricated orthotics? One reason is the size of the foot orthotics market, which is expected to exceed $50 billion by 2024. There are several factors which are driving this growth. The aging population, so people are living longer. A change in the lifestyle, people are being active for longer. And an increase in the general standard of living. Also an increase in the knowledge of how important foot care is in diseases like diabetes and obesity. With the increase in population number, it means there's an increased rate of end users using orthotics and a spread of these around geographical areas. There is also an increase in general healthcare spending. People are spending money to try and be active and healthy for longer. And with the increased enhancement of technologies, access to foot care is exploding worldwide. I'll now talk about two general styles of prefabricated orthotics. They are available based on how they are designed to be used. The first type I will call ready to wear, or OTC, over the counter. These are ready for patients to use immediately. They will generally have some type of top cover, have set attributes or design features. They're designed for minimal or moderate modification. It's very common for these to be the retail versions of orthotics, but they're also very popular with physios, chiros, and podiatrists who select them to match the exact requirements of their patients and do some mild modifications. DOLA's range of ready-to-wear orthotics are called patient-ready orthotics. There are 9 styles, all come pre-covered with specific design features or combinations that allow you to treat very common clinical presentations. They also allow for plantar modifications. The second style based on usage I'll call thermoplastic, or a modifiable blank. Generally, these styles won't have a cover. They have baseline attributes, including density of shell material or type of shell material, the shell shape, and they are designed for significant modification to the exact prescription required by the practitioner. They can be heat molded with various additions and specialty covers. This style is most popular with podiatrists as they get to design the exact orthotic required for their patient.
Within the thermoplastic prefab style, manufacturers offer different shapes to suit the different styles of footwear patients want to wear. Selection of the best style is a key prescription choice for all health professionals. A traditional full-length orthotic shape will fit best to footwear with a removable insole. This includes work boots, medical-grade footwear, and sports or walking shoes. For harder-to-fit footwear, including football boots, skates, street or casual shoes, and even some sport shoes with a narrow waist, select an option with a reduced plantar footprint and tapered medial and lateral borders. A 3/4 length device is a great option for shoes without a removable insole, including business, slip-ons, or fashion shoes with a reduced toe box volume. A very low bulk option also exists for ballet flats, sandals, high heels, and women's dress shoes. Unique design features, including a self-adhesive plantar surface, will reduce the slippage in high-pitched footwear.
In this next section of the presentation, we will look at what you can do with a prefabricated orthotic, focusing on the most common modifications you can make to a thermoplastic blank to customize the design for your patient. What pathologies can you help treat or prevent, and how do you make these modifications in clinic? However, your choice of which prefabricated orthotic is best to use for your patient should be based on: is there an OTC orthotic that has the attributes you're after? If not, are they easily added? And what prescription do you want to add if you're making an orthotic blank? Where is your addition applying force? What material properties do you need your additions to be made out of? Do you need EVA for increased control and force, or Poron for added cushioning properties, or the DOLA tech sheet for torsional resistance? The aim of your prefabricated orthotic design can be identical to a custom orthotic. Often my students benefit from looking at where the orthotic prescription variable acts on the foot, and then relate back to the pathology or biomechanical theory. The following pictures are from the DOLA Orthotics custom manual, which is available on our website. Do you have a patient where you are looking to provide a medial orthotic reaction force? Can you provide the amount of force required in the area needed in relation to their subtalar joint axis using a prefabricated orthotic, and modifications including a rear foot or medial varus post, an MLA arch pad, or an inversion ramp? Or does your patient require a custom design? Do you have a patient where you are looking to provide a lateral orthotic reaction force? Can you provide the amount of force you require in the area needed in relation to the joint axes of the subtalar joint and mid-tarsal joint using a prefabricated orthotic, and modifications including a lateral or rear foot valgus post, a lateral longitudinal arch pad, a forefoot valgus extension, a cuboid pad, or an eversion ramp? Or does your patient require a custom orthotic design? Are you looking to improve sagittal plane function at the ankle of the first MPJ, in additions including a heel raise, a reverse Morton's extension, a forefoot valgus extension, or a Cluffy wedge? Or are you trying to help with symptomatic tissue stress pathologies by customizing your design to the patient's presenting complaint? A Poron heel pad or cushion for chronic plantar heel pain or fat pad syndrome? A metatarsal dome for metatarsalgia or metatarsal capsulitis, bursitis, neuritis, or neuroma? Or a forefoot valgus extension to help improve windlass activation and propulsion? It's your patient, it's your choice. In this section, we'll teach you how to DIY the most common in-clinic modifications performed on a prefab. Key features of the DOLA Pro full-length orthotic include the customizable EVA shell that is heat moldable and grindable, the pre-enforced stable flat plantar surface that doesn't require reinforcement prior to prescription. You can also grind up to 6 degrees of varus or valgus posts without the need for additional reinforcement, and clinical markings that help with the consistency, repeatability, symmetry, and accuracy of your modifications. The DOLA Pro full length has clinical markings that assist in manufacturing. They include the heel bisection line, rear foot varus and valgus guidelines, guidelines for forefoot wedges and extensions, and guidelines for Morton's and reverse Morton's extensions.